Hey, we're back again here today with Jonathan Sockell, the Chief Operating Officer of Limbix, a virtual reality therapy company. He's going to be telling us a little bit about what they're working on at Limbix and what he's going to be speaking about at AnxietyTech. Thanks so much for joining us, Jonathan.
Thank you for having me. We're excited. I'm excited to come.
I'm excited. Yeah, I'm excited for you to speak and share what you're doing. Tell us a little bit about yourself and how you got involved in this thing.
Yeah, so I'm a technology entrepreneur working out in Palo Alto. Love finding ways to use technology to improve the way that we live lives, that we work, that we play, things like that. And then as far as how we got into Limbix, we wanted to build Limbix because we had seen so much research show that virtual reality can play a very meaningful role in the way that we treat patients for a variety of disorders.
Okay.
So what we had seen were mountains of publications and lots of different ways that supported its use, but the price point of VR hadn't really come down in an accessible way.
Right.
So we wanted to start Limbix to create access that allowed more of these treatments to be made accessible in hospitals and clinics, domestically and around the world.
So let me ask, as you have been developing this, how long has this been in development, Limbix?
So we started Limbix in the fall of 2016. By summer 2017, we launched an initial version of our product, primarily used for exposure therapy.
Okay.
Exposure therapy is something that's pretty common in psychology and psychiatry, and cognitive behavioral therapy is sort of really supports exposure therapy.
Okay.
And we built a tool that allowed private practice psychologists and psychiatrists to administer these exposures in their existing therapy practices.
Okay.
And after launching, we learned a lot of feedback from hospitals who also asked for virtual reality.
Okay.
And in that process, we learned there was a few things that we needed to update to the way we delivered VR, and so that it could be consumed in medical setting in a way that kind of would fit into the existing workflows of medicine.
So you were showing me earlier, you've got an Oculus Go there, handy. Could you tell us some of the things that work well and some of the things that might need to be modified to make it more successful in a clinical setting?
Well, you can't just give a consumer-grade VR device to a hospital. You can imagine patients uncovering types of content that would maybe be very inappropriate in a medical setting. There's also hardware modifications that are required too. When you have multiple patients, there's things like germs that we have to worry about.
Right.
Okay.
So we're making modifications to VR hardware that allows it to be used in a medical setting. These include a few things like using materials that can be wiped with alcohol that won't really erode the quality of the materials, customizing straps so that you can, and putting ratchets on them so you can put them onto patients without actually touching their body parts. Other things like working offline. And a lot of times when these clinics and hospitals, it can be a challenge to get onto Wi-Fi systems, or there's thick walls between rooms and these cause connectivity issues. So we built an offline standalone solution that hospitals and clinics can use to administer VR treatments.
So I'm curious about that. Are you looking mainly at these portable devices like the Oculus Go or Daydream, or something that connects to a computer like the Rift?
We're looking at portable devices. Ease of use and making VR accessible to people who are newer to using technology is really important to us. And while a lot of some of the highest, or at least a lot of virtual reality to date has been PC-based, more and more standalone solutions are presenting themselves, and we find that people just have a much easier time operating these systems.
That makes a lot of sense. So, we've been talking with a lot of people, getting ready for the conference, thinking a lot about this idea about, is technology sort of inherently harmful? Obviously, what you're doing with Limbix is trying to help people. Do you see technology sort of as a net negative for mental health? Or obviously, I assume you're going to see it as a positive. Tell me a little bit more about that, though.
We'll certainly see it as a positive, but I think that one thing that's really important when you're building tools that are going to be used to treat mental health disorders and other disorders is that you have to find a way to build it into the workflow of clinicians and make clinicians a part of that process. So we're not trying to create technology that replaces people necessarily. We're trying to create new tools that help administrators, staff, and clinicians be much more effective with the way they work with patients today.
Right. And do you find like certain types of like disorders use VR more? Like I have obsessive compulsive disorder, and I know like my psychologist is really into or wants to be really into the VR aspect of training for people who have like, you know, fear of flying or throwing up or things like this that you can't really do like typical exposure therapy just like on your own. It's like, I can't go out and fly on an airplane every day to do my exposure therapy or things like that. Like, do you have specific types of therapy that you have to focus on more than others?
Yeah, I mean, so we talked a little bit about the exposure therapy product we launched last year. We certainly tried to cover as many of the common phobias, anxieties, and traumas that help that people could practice. And like you said, it's impractical to, if you're afraid to fly or afraid to drive, to necessarily get in the car or to take off up and down on an airplane 100 times in a row. And so that's where VR can be a really good tool for practicing these things. And then now today, we're continuing to add other types of content that can be psychoeducational, that can be distracting and entertainment, lots of different use cases in hospital settings where VR can be helpful, whether it's giving it to kids who are afraid to get their blood drawn, or maybe teaching mindfulness to a cancer patient going through chemo. Certainly lots of different use cases we've seen for VR. Exposure therapy is where our foundation is, but we're certainly trying to cover more and more of the gamut that we see in medical settings.
That's awesome. I had a question about the content development for this stuff. So obviously there's multiple parts. You said you're modifying hardware, you're obviously developing content. What sort of skills do designers, developers, and other people interested in this type of thing? What sort of skills do they need to have to help build this type of stuff?
Well, a lot of what we've tried to put in place is a technology stack that allows video production producers to pretty easily bring their ideas into VR. And so what we do at Limbix is we enable researchers to create their ideas in VR, put it onto our system, validate that there's efficacy for their whatever it is that they're studying, and then ultimately what we can do is deliver hospitals evidence-based treatments. And so when you think about the skills for creating VR, what we've tried to do is build a system where researchers can have an outline of what they want to do, and they can work with our video production teams, our in-house research teams, and ultimately design what they want to do in VR, and then we make it happen for them by working with our production partners and working with our research partners to then run studies on those after everything's been produced.
Awesome. Well, thanks so much, Jonathan, for talking with us today. I'm really excited to learn more about all the stuff that you're working on, and I hope everyone can come to AnxietyTech next month and get to meet you and hopefully see some demos and learn more about what you're doing.
Yeah, we'll bring a demo. Would love to obviously encourage folks to come to this event. We'll talk about considerations for building VR for enterprises and hospitals, lessons that we've learned over 2 years of kind of slogging through a few mistakes and then figuring out what we sort of think the future of VR is going to be in health.
Awesome. Well, it's going to be amazing. Yeah. Thank you so much, and looking forward to seeing you talk.
That's right. See you in a few weeks.
All right.